Did you know that Wikisana is the largest search engine?
Insider tip. If you want to find out more about medicine, then simply go to Wikisana.
Become a Wikisana subscriber now.
Are you already on Wikisana?
Welcome, dear viewers, to our natural medicine format. Today we're talking about asthma. Every 10th child and every 14th adults in Switzerland are affected. What are the causes, including the frequency of this disease? I have the pleasure of talking to Alexandra Kotthaus about this today. She is the head doctor at the BioMed Center Sonnenberg in Schwellbrunn, and she is a specialist in general medicine and a specialist in psychiatry and psychotherapy. And I'm looking at this with her today. Stay tuned. Hello, dear Alexandra.
Hello, Silvia.
Nice to have you with us today. And asthma is a topic that I also come across very often. And also in my subjective perception, I had the feeling that it has really increased.
Yes, that's true. So statistically speaking, it is something that is increasing rather than decreasing. And if you take a look at how asthma sufferers are helped, it's actually mainly about how to use the inhaler correctly. And not, how are there other ways to treat it, or are there any possible causes behind it? You might actually hear, yes, it could have something to do with air pollution. Sometimes ozone levels in the air are also cited. I don't think I haven't researched this in detail, but I'll just throw it out there that you can question the ozone issue critically, because the ozone content doesn't increase on its own, but when the ozone is high, it's simply also a marker for the fact that particulate matter is high at the time. And this is sometimes blamed on ozone. But we also know that ozone can also have good properties. And the other thing is that the causes are simply never investigated. And I mean, you can asthma, in contrast to a few decades ago, quite well a few decades ago. And a few decades ago, people died much, much more frequently from an asthma attack when it become very extreme. That hardly ever happens anymore, and that is, of course, an important step forward. But the fact that children, especially children, are not treated causally, I actually find it creepy. I just find it creepy that I always think that gynecologists and pediatricians should somehow realize that something is wrong in the world. We're not doing any disease prevention at all. We're just asking how we can manage these diseases, but not how to tackle the causes of the diseases. And the extent to which this is occurring and becoming more and more self-evident. If you look at recent films, the children in the movies all have something. Then they have a spray with them and they're dropped off at nursery. But my child is not allowed to eat this and that. So it's finding its way into all the media. And there are two sides to it all. On the one hand, it's so good that it's becoming socially acceptable, that the child is not an outsider as a result. And on the other hand, this pathology is normalized. And I see a danger in that. On the one hand, I also see the good in it, but I also see the danger in it too. We simply accept it. The more normal it is, the more it surrounds us, the more numb we become to it. And it's actually so easy.
Yes, but now I'm really curious, because the causal thing that I've always heard is that you're just perhaps due to allergies. It may disappear over time. But it's just that the treatment of symptoms is somehow the main priority.
No, it's actually the case that asthma doesn't disappear at all. So not in the younger generations, but rather increases from the age of 0 to 17.
Okay.
And there are also people who think they are former asthmatics and then tell me as an adult in the consultation, no, I don't have asthma, and I listen to the lungs and think, I don't believe that, because they may have had an infection shortly before, and the lungs are still tight. So that's something I see very often. Someone who no longer has asthma attacks as an adult is still more prone to respiratory infections where the lungs also react or are even narrow. But not to the point of having an asthma attack or hear the whistling of the lungs, but just that you cough a little longer or need a little longer after a cold to be able to climb the stairs again quickly.
And does that then, of course, also cause increasing damage to the lungs?
That is an inflammation. And the more chronic and the longer it lasts, the more likely it is that the lungs will be damaged. If someone no longer has to die from an asthma attack because they are then also possibly receive cortisone, I use this to lower the inflammation and then an agent that widens the bronchial tubes again. So asthma has three components. It's the spasm, the cramping of the bronchial muscles, but also a swelling of the mucous membranes and thick mucus, which is not as fluid or as easy to cough up as without asthma or with a normal cold. And this is why these medications are used, medications that expand the lungs and cortisone. With asthmatics, cortisone tends to be used rather than drugs that expand the lungs because there is usually an allergic component behind it. This is now referred to as the atopic form and includes asthma, hay fever, and neurodermatitis. And many people actually have all three at the same time. What I also find alarming is that around 39%, yes, 39% of girls and 55% of boys are sensitized to inhalants by the time they reach adulthood, are sensitized to inhalant allergens. So inhalant allergens are pollen, but also animal dander, cats, dogs, house dust, mites. Yes, that half of our children have antibody reactions and allergies. So perhaps not yet this full picture with hay fever, asthma, neurodermatitis, and let's take a look at how work. Contain aluminum because aluminum promotes the production of antibodies. So we need the aluminum. That's not just to be a bad thing, but aluminum so that the antibodies are produced at all. The second, so that even more people produce the antibodies, and the third, so that most people at least do. And what you also know is that if I a baby now, I have 60 times more aluminum in my because otherwise the immature immune system would not produce the antibodies at all.
Wow.
But now we have, this is just a technical description from the field, but now we have heavy metals in us. We don't need to fool ourselves. An infant also carries toxins and heavy metals. And then there are other factors, namely the antigen and wherever it comes from. And in combination, antibodies can be produced. And this also plays a role in an overshooting immune system.
What I see in the atopic form, with which one usually great success is very suddenly, I don't want to say with everyone, the elimination of all dairy products, exciting, yes.
So there is a very big cross reaction. That is a very big trigger for these things. Also white sugar. There are certainly diseases that are of a different nature, but we also have an increase in celiac disease. In the last few decades, there has been a 5 or 10-fold increase in the incidence of true celiac disease. Yes, that means that diet plays a huge role. Children used to get milk from other species, i.e. not human milk products, in the insane belief that it is good and that they need a lot of it. Other food too, even if it is actually wholesome and has an organic seal on it, is not necessarily completely natural or species appropriate. We simply have a certain toxin load. We have more and more because the world is growing together, and most of the time we don't marry the one with whom we first had, let's say, an exchange of bodily fluids. We also have a higher level of contamination with various viruses. Yes, so we accumulate things in our barrel of health relatively early on, and we have simply reached a level where the children are getting sick more and more often, earlier and earlier.
Okay, and that all makes a lot of sense to me. We've already discussed certain things about nutrition in the other program. And what does that mean in concrete terms for mothers, that they really need to be aware of the importance of nutrition right from the start? Or perhaps, as we have already discussed for prospective mothers, perhaps they should also look at their lifestyle and not forget the fathers. And if a child has already developed asthma or an adolescent, you can really achieve a lot with a change in diet. Did I understand that correctly?
Of course, with asthma, it is quite clear that a lot can be achieved through diet. There are young people who simply stick to it. And there are young people who are a bit more dependent on their peer group. They find it a bit more difficult to stick to it. But those who suffer a lot and realize how good it does them, they naturally find it easier to stick with it. So nutrition is a key component, but so is detoxification and treating the gut. Chinese medicine also says skin, lungs, large intestine. So that's also part of it. And that means there are many possibilities. Say our patients died, or the young ones were already patients, or who have been on an organic diet for a long time and then have children. You have to say that we simply see a lot less of that. The patients who are already doing everything on their own, implementing nutrition and saying, no, I'll resort to natural remedies first if there is an illness. So we have the patients who have been cared for by Thomas Rau for decades now, who hardly have the typical diseases of civilization in old age. In other words, the most common diseases in the average population are high blood pressure and diabetes. Our patients hardly ever have them.
So great.
So these are actually the things that are the easiest to treat as a biological physician.
That's what we say now and otherwise, as why only symptoms are often treated. But if someone also has an allergy, as you said at the beginning, with animal hair or whatever, can that also change with the diet?
Yes, definitely. It's always about removing the inflammatory potential. Yes, you could also say it's an anti-inflammatory diet. We restore the liver and large intestine, the liver as the most important, largest detoxification organ. The intestine, which has to transport everything out, but is of course also responsible for absorption. And so what makes our barrel full? Reduce that again? It never remains completely empty. I also have patients from time to time. I did chelate therapy in 2016. Now I've fallen ill. They did that in the meantime, so I didn't do much. Then, of course, the barrel got full again. Unfortunately, it's become something where you have to stay on the ball regularly. Not necessarily all the time, but there are different options. But I would say that someone who is totally healthy should perhaps still go for a cure twice a year and make sure that this is enough. So I didn't do a deep, profound detox in a 4 or 6 week course.
Of course, I still have a question about that. When people look at me now and say, yes, I'm actually fit, but I just really want to follow this recommendation and maybe do a detox at home twice a year. What would you recommend? What should you take or do?
I don't do it. I'm not going to answer that.
Okay? Because it's so individual?
Yes, that would be naive. I know that sometimes people would like more concrete advice after the shows. Yes, and then I thought about it. But sometimes it's so individual. There's no such thing as a standard formula. Say every doctor certainly has their toolbox that they prefer, where they have their favorite tools. But I'm also aware that I have that. And then I always have the feeling that I always do it differently. Then I had a married couple sitting in front of me, and I always said that it doesn't apply to him. It only applies to her. Where I say, yes, I do it very individually. There are people, there are women who hear the grass grow, and there are men who don't notice anything. Sorry if I'm being so polarizing. And they're always the wrong ones, so to speak. Then I give out a scheme X, and then they do it, and then it goes wrong. But that's what Ms. Kotthaus recommended. It's too individual. And I think I've simply found that so many people are simply too naive about how healthy or how ill they actually are.
Yes, with detoxing you can really get massive disorders if you do too much.
Yeah, I see so many detox side effects. Not for me, by the way, because I just do it carefully now. I don't give any general recommendations. Sorry, that's not possible.
Then I take the question back, and then we just say let's say fruit, vegetables with good, of course, organic products, diet, that they also take a small step towards detoxification, a big step towards detoxification.
But even there, how extreme I take it, I do it differently for different people. Because there are bodies that are waiting in the wings, so to speak. And if you give them the right thing now, then yes, I'll get started, and then they overestimate themselves. So then there are side effects. And that means sometimes there are people for whom I recommend a more extreme form of nutrition for 7 days, a reset, so to speak. And for some people I say, don't do it. Yes, because then it's too much. Now, I have a patient who has been very, very, very good about not starting the dietary supplements until she has passed urine. To ensure that the urine results are not falsified, she is now on vacation, so she didn't pass the urine until then and only then started taking the supplements, but she strictly followed the diet beforehand and said, I felt so much better for the first week. My tummy felt great, and then it got worse again, and only then did she start with the stuff. And that's how it is. The body is doing great. I'm finally getting the ground that I can throw out, that I can start to detox. Because the liver supports the gut, and then it packs so much into it that the system can't even carry it. Because a lot of patients don't come, and I'm the first place they go. They tried it themselves. They were somewhere else or something. First, I prepare the ground, I prepare the organs so that the detoxification can begin. I first replenish the safety nets in the body so that they are prepared for what is to come.
That's a very wise thing to say. For me too, because I'm always enthusiastic. If I think something is great, then you do it, and then you know what you want to get rid of.
There are many methods that help me progress faster for a while, lift me to a better level, and then I crash. And almost everyone can relate to that, because you simply did it too quickly or didn't pay attention to certain things. Or my friend said it worked really well for her.
Yes, and then the body, as you said so well, really starts to detoxify. And then in the end, it can't be retained or excreted.
So sometimes it's 1 step forward, 2 steps back, or 3 steps forward, 2 steps back. And I just say, so I don't do it. I want to know how they react first. I rarely make a more intensive therapy recommendation before the second appointment. At the second appointment, if they've stuck to the dietary recommendations, if they've stocked up on the most important things, if we've prepared their liver and intestines, and if I then know after about 4 weeks that something has already happened to most people in these 4 weeks, then I can assess much better how they have reacted, how ready the body is. Or I hardly have anyone who is totally blocked. Worse, not at all, because I proceed very carefully. And that's when I actually do the fine-tuning for the therapy. Then I have a lot more lab results. So more is actually not that much. I would also like to say that. And then comes the fine-tuning. And then I'll have a look. I need to order one closer. The next one gets more therapy. So much has happened with the other one. Then I know I can let him go on like this. Or sometimes I have to warn people who have a serious lack of certain things. And I recharge them. So there is the type that gets severe side effects where you have to be even more careful. But many of them are like a phoenix rising from the ashes. And then at some point there comes a damper. So at some point there's another plateau and so on. You have to be on the ball and make adjustments. That sucks so much. I was already doing so well, and now there's another little setback. But it's also a bit physiological. There are no cars, but the curve goes like this, and then you have to readjust.
So I have to say that it speaks for you that you don't generalize like that, because it's often presented a little too simply. You just take this or that, and then you detox. But how complex our system is, and where does the toxin come from? How is it transported out? What can the body actually do? I think it's really good that you made this so clear and didn't answer my question. Now I have another question. Someone I know did come to mind. He had really, really bad asthma as a child. That then disappeared and has now developed severe neurodermatitis in adulthood. And no connection was actually seen.
But when you say it like that, it's actually very strange to me because it's actually also conventional medical data and correlations that many people could have mixed it up.
And there was probably also latent asthma? Or does that have nothing to do with it? Or could it be that the asthma is completely gone and simply from this form?
In other words, someone who has not treated it causally, my experience is not that it is really gone, but often only below the perception threshold. And there are commonalities if it is simply in atopic form. And it can be one or the other. In the same people, even at different times, but also at the same time.
And then there's the recommendation to change your diet. And when you say causal treatment, the change in diet, are there other things, detoxification, micronutrients, or do they all belong together?
They all belong together. Of course, refueling and detoxifying is one thing, but of course we also treat symptoms when necessary. Yes, I also have an acute asthma attack, which I have already treated with neural therapy. So please don't be naive now. And so I think someone who has asthma should already be familiar with their emergency medication, how to take it, and have it with them. Because that's the way it is. They can save lives. But someone who really takes a causal approach can also massively reduce this. The frequency of seizures, the intensity of seizures, and in the best case become completely free of them. Yes, but that's already a win because the fewer seizures I have, the lower the frequency is also a sign that the less inflammation I have and the better in the long term. Not to say life expectancy, but also that you have exactly the same quality of life in later life, even in the long term. And not just short. And of course the less cortisone I need over my lifetime. So cortisone can save lives. It's not exclusively bad. It has to be used correctly. It can also save lives in other acute or severe illnesses or autoimmune diseases. There are a few conventional medicines that are very valuable when used correctly. The problem is always when I use them incorrectly and permanently. And we have certain options here to put other things first, even acutely. As I said, I have also treated asthma attacks with neural therapy, but it's not a guarantee. But of course, it's nice when it works. But it's not as if you should throw away your asthma inhaler straight away. That would be naive again. I think it's a nice sentence. Allah looks after your camel, but you have to tie it up.
Yes, very well said. Yes, and I also think it's very important, as you mentioned, that nobody thinks, yes, now I'm going to change my diet, detoxify myself, and then I won't need the asthma inhaler. And that's what I think is important, the cooperation between conventional medicine and other medication and other therapies. And I think that's really important. It can also be an incredible relief to receive cortisone from time to time in chronic pain or whatever, or during an asthma attack. And I think it's important to simply see that both have their justification. Thank you very much, Alexandra, for being with us again. It was so exciting again. As always, I still have a lot of questions in my head, but we'll be doing more shows, and I'm already looking forward to them. Dear viewers, for me there was a lot of enlightening information again, and also a lot of hope that it is possible to treat diseases that are often only treated symptomatically in a truly causal way. And I hope you were also able to take something from this program. See you and goodbye.